Okay, in this video we're going to go over segmental movement of the spine. So the core goal and objective of this drill is to relax into the movement and show the nervous system that this is a safe position to be in. So if you're receiving this video, it is safe to say it is okay to move through this range, as long as, of course, respecting your pain levels, respecting any type of response that's going on in your body, but gradually exposing yourself to this movement that is safe. So to start, I'll have you, sitting on the ground, and this is called a long sitting position. But instead of having your knees fully straight, I want you to start with your knees about 90 degrees, like so. You can have your arms here to help support yourself, or you can place your hands by your sides, whatever you feel most natural and most comfortable with. For me, I like it underneath my thighs here. And what I'm going to have you focus on is moving from the pelvis through the lumbar spine up to thoracic spine, and then tucking your chin at the very end. So what I'm going to have you do is breathe out as you tuck your tailbone underneath you. Try your best to round your lower back. Again, it's one vertebrae at a time, so it's really slow. So you're slowly rounding until you get to your upper back, and then you tuck your chin in last. And then what you're going to do from here is I want you to cycle in 2 deep breaths. So I want you to fill up the lateral, or the side-to-side movement inside of your cavity here, your stomach and your diaphragm. So I want you to fill your belly up. And then once you breathe out, so again, you're staying in this flex position for 2 cycles of breath. And when you're ready to inhale, you're going to untuck your pelvis to a neutral position. Get your spine to straighten out again from the lumbar spine up to the thoracic spine, so your lower back to the mid back to the upper back. And then last but not least is going to be your chin or your cervical spine area. So again, going through the cues, knees are going to be bent 90 degrees. Support yourself with your arms. You're going to tuck in your pelvis as you breathe out. Round through the lower back as much as you can. And then round through the mid back, round through the upper back. Last is your chin. Cycle through 2 deep breaths. And then from there, slowly untuck the pelvis. Extend or straighten through the lower back, through the mid back, upper back, and last is your chin. And then over time, after maybe cycling through 2 rounds of that, you can slowly straighten your knees out a little bit further. So as your knees get straighter and in this position that you're in as far as your spine, you put more tension in the tissues underneath your legs or behind your legs here. So the nervous tissue, so nerves, soft tissue, muscle, fascia, all those type of things. So that could be a little uncomfortable. So again, you work up to it. So you start with the 90 degrees, maybe go somewhere around 50 to 45 degrees. And then let's just say after doing a few rounds, this is the area you feel most comfortable in. This is maybe 25, 30 degrees of knee bend. And then that is a good place and a good goal to try to progress a little bit more as you feel comfortable. Working through nerve tension takes the longest amount of time, and it's very important to respect how your body feels. I don't want you to get into a range where you feel a really intense stretch. It should be just before a stretch is felt, where you are doing the movement of the spine and working on your breath work. Breathing is really important to help downregulate the nervous system. Again, you're trying to retrain your body, your spine, your back, that this is a safe range to be in so that you can get back to the activities that you enjoy doing.